Sjogren's syndrome, fibromyalgia, and lupus are complex autoimmune diseases that often share overlapping symptoms, making early detection particularly challenging. Recognizing the most dangerous early signs is crucial, as timely intervention can significantly improve patient outcomes and quality of life. Symptoms such as persistent dry mouth and eyes, widespread pain, and unexplained fatigue may signal the onset of these conditions. Recent research has identified specific autoantibodies and risk factors that can help distinguish between these diseases at an early stage. Early identification not only aids in accurate diagnosis, but also allows for more effective management and monitoring of disease progression. Understanding these warning signs empowers both patients and clinicians to take proactive steps toward better health. Autoimmune diseases occur when the body's immune system mistakenly attacks its own healthy tissues, leading to a wide range of symptoms that can affect multiple organs. Conditions such as Sjogren's syndrome, fibromyalgia, and lupus often present with similar early signs, including fatigue, joint pain, and dryness of the mouth or eyes. This overlap in symptoms can make it difficult for healthcare providers to distinguish between these diseases, especially in the initial stages. As a result, patients may experience delays in receiving an accurate diagnosis and appropriate treatment. The complexity of these conditions highlights the importance of careful evaluation and ongoing research to identify unique markers that can aid in early detection. Understanding the subtle differences between these autoimmune disorders is crucial for improving patient outcomes and guiding effective management strategies. Recognizing the early warning signs and risk factors of Sjogren's syndrome, fibromyalgia, and lupus is essential for timely diagnosis and intervention. Sjogren's syndrome often begins with persistent dryness of the mouth and eyes, and recent research has identified novel autoantibodies such as SP1, CA6, and PSP as potential early markers. Fibromyalgia typically presents with widespread musculoskeletal pain and fatigue, and is more prevalent in individuals who already have autoimmune conditions like Sjogren's or lupus. For lupus, unpredictable flares and symptoms such as joint pain, skin rashes, and kidney involvement can serve as early indicators. Studies have shown that higher disease activity scores and lymph node swelling in Sjogren's patients may signal progression toward lupus. Identifying these warning signs, along with specific biomarkers, can help clinicians distinguish between these overlapping conditions and improve patient outcomes. Sjogren's syndrome is an autoimmune disorder in which the body's immune system mistakenly targets and damages moisture-producing glands. This attack primarily affects the salivary and tear glands, leading to hallmark symptoms such as persistent dry mouth and dry eyes. These symptoms can significantly impact daily life, making it difficult to speak, eat, or maintain eye comfort. In some cases, dryness may also extend to other areas, including the skin and nasal passages. Early recognition of these signs is important, as Sjogren's syndrome can sometimes progress to involve other organs and systems. Understanding the underlying immune response helps explain why these symptoms occur and highlights the need for timely diagnosis and management. Recent scientific breakthroughs have identified novel autoantibodies, specifically SP1, CA6, and PSP, as early markers for Sjogren's syndrome. These autoantibodies can be detected in patients before the classic symptoms of dry mouth and dry eyes become pronounced. Their presence offers clinicians a valuable diagnostic tool, enabling earlier and more accurate identification of Sjogren's syndrome. Studies have shown that a significant proportion of individuals with overlapping symptoms, such as those seen in fibromyalgia, may test positive for these markers. This finding not only improves early detection, but also helps differentiate Sjogren's syndrome from other autoimmune conditions with similar presentations. As research continues, the use of these autoantibodies may pave the way for more targeted and timely interventions for affected patients. Sjogren's syndrome and fibromyalgia are two distinct autoimmune conditions, yet they often share overlapping symptoms such as chronic pain, fatigue, and dryness of the mouth and eyes. Recent studies have revealed a notable connection between these disorders, with a significant number of patients experiencing symptoms characteristic of both. Autoantibody testing has played a pivotal role in uncovering this link. For instance, novel autoantibodies like SP1, CA6, and PSP have been identified in patients with fibromyalgia who also report dryness symptoms, suggesting an underlying association with early-stage Sjogren syndrome. Research indicates that up to 26% of fibromyalgia patients with these symptoms test positive for Sjogren-specific autoantibodies. This overlap not only complicates diagnosis, but also highlights the importance of comprehensive evaluation in patients presenting with persistent pain and dryness. Certain warning signs can indicate that Sjogren's syndrome may progress to lupus. High disease activity scores are a key marker, reflecting increased severity and immune system involvement. Patients who experience swelling of the lymph nodes are also at greater risk, as this suggests heightened immune activity. Additionally, kidney involvement at the time of initial hospital evaluation is a significant predictor of progression. These symptoms highlight the importance of close monitoring in individuals with Sjogren's syndrome, as early detection of these warning signs can lead to more timely and effective interventions. Recognizing these indicators allows healthcare providers to better anticipate and manage the potential transition to lupus. Fibromyalgia is a chronic condition that primarily manifests as widespread musculoskeletal pain and persistent fatigue. Individuals affected often report tenderness throughout their body, along with disrupted sleep and cognitive difficulties sometimes referred to as fibro fog. These symptoms can fluctuate in intensity and may be accompanied by headaches, irritable bowel syndrome, and heightened sensitivity to touch or temperature. Because fibromyalgia shares many symptoms with other disorders, such as arthritis or autoimmune diseases, it is frequently misdiagnosed. The lack of specific laboratory tests or imaging findings further complicates accurate identification. As a result, patients may undergo numerous evaluations before receiving a definitive diagnosis, highlighting the need for greater awareness and understanding among healthcare providers. Recent studies have revealed a notable overlap between fibromyalgia and systemic autoimmune diseases such as systemic lupus erythematosus and Sjogren's syndrome. In particular, research from 2024 found that approximately 25% of patients diagnosed with Sjogren's syndrome also exhibited symptoms of fibromyalgia, with women being disproportionately affected. Similarly, individuals with systemic lupus erythematosus show a higher prevalence of fibromyalgia compared to the general population. This comorbidity can complicate both diagnosis and treatment, as the symptoms of widespread pain and fatigue often mimic those of the underlying autoimmune conditions. Recognizing this association is crucial for clinicians, as it underscores the need for comprehensive evaluation and tailored management strategies for patients presenting with overlapping symptoms. Comorbidity between fibromyalgia and other autoimmune diseases, such as Sjogren's syndrome and lupus, presents significant challenges for both diagnosis and treatment. When these conditions occur together, their overlapping symptoms, like chronic pain, fatigue, and dryness, can make it difficult to distinguish one disease from another. This complexity is particularly pronounced in women, who are more likely to experience multiple autoimmune disorders simultaneously. Studies have shown that women with Sjogren's syndrome are at a higher risk of also developing fibromyalgia, further complicating clinical assessment. As a result, healthcare providers must conduct comprehensive evaluations to avoid misdiagnosis and ensure that each condition is properly managed. Tailoring treatment plans becomes essential, as therapies effective for one disease may not address the symptoms of another, highlighting the need for personalized care strategies. Lupus is a complex autoimmune disease that can manifest with a variety of early warning signs, many of which are subtle and easily overlooked. One of the most challenging aspects of lupus is its unpredictable flares, where symptoms can suddenly worsen without clear triggers. Early signs often include persistent fatigue, joint pain, and unexplained fever. Some individuals may experience skin rashes, sensitivity to sunlight, or swelling in the hands and feet. Because these symptoms are systemic and can mimic other conditions, they are frequently missed or attributed to less serious causes. Recognizing these early indicators is essential for timely diagnosis and effective management of lupus. Recent advancements in lupus research have led to the creation of a proteomics-based risk prediction model, offering new hope for early intervention. This model centers on 5 key proteins: SAA1, B4-GALT5, GIT2, NAA15, and RPIA, which have been identified as significantly associated with the risk of lupus flares. By analyzing both clinical data and protein profiles, researchers can more accurately forecast periods of heightened disease activity. Such predictive tools are especially valuable for populations where lupus presents with unique challenges, as demonstrated in recent studies focusing on Asian cohorts. The integration of proteomic markers into patient care may enable more personalized treatment strategies, potentially reducing the severity and frequency of lupus flares. This innovative approach marks a significant step forward in managing the unpredictable nature of systemic lupus erythematosus. Integrating clinical and proteomic data offers a powerful approach to improving early intervention and personalized management for lupus patients. By combining traditional clinical assessments with advanced proteomic analysis, clinicians can identify specific protein markers associated with disease activity and flare risk. Recent studies have highlighted proteins such as SAA1, B4-GALT5, GIT2, NAA15, and RPIA as significant predictors of lupus flares. This integration enables more accurate risk prediction, allowing for timely adjustments in treatment plans tailored to individual patient profiles. Ultimately, this approach enhances the ability to anticipate disease progression, minimize complications, and optimize outcomes for those living with lupus. Recent advancements in electronic health records have provided valuable insights into the complex nature of lupus. By analyzing large data sets, researchers have identified 19 predictive sources that contribute to the heterogeneity of systemic lupus erythematosus. These sources include variations in clinical presentation, laboratory findings, and genetic markers, all of which can influence disease progression and response to treatment. Understanding these diverse factors allows clinicians to better recognize early warning signs and tailor interventions to individual patients. This approach not only improves early detection, but also supports more personalized management strategies for those at risk of developing lupus. As research continues, integrating electronic health record data promises to enhance our ability to predict, diagnose, and treat lupus more effectively. Sjogren's syndrome, fibromyalgia, and lupus are autoimmune conditions that often share overlapping symptoms, such as fatigue, joint pain, and dryness of the mouth or eyes. However, recent research has identified distinct early warning signs and risk factors that can help clinicians differentiate between these diseases. For example, Sjogren's syndrome is frequently marked by the presence of novel autoantibodies like SP1, CA6, and PSP, which may appear before classic symptoms develop. Fibromyalgia is commonly associated with widespread musculoskeletal pain and a higher prevalence in women, especially among those already diagnosed with Sjogren's or lupus. Lupus, on the other hand, can present with unpredictable flares and is now being studied using proteomics-based models to predict flare risk, particularly in Asian populations. Recognizing these unique markers and risk profiles is essential for early diagnosis and tailored treatment, ultimately improving patient outcomes. Monitoring disease activity and recognizing overlapping symptoms are essential steps in achieving timely and accurate diagnosis of autoimmune conditions such as Sjogren's syndrome, fibromyalgia, and lupus. These diseases often share symptoms like dry mouth, fatigue, and joint pain, which can make distinguishing between them challenging. By closely tracking changes in symptom patterns and disease markers, clinicians can identify early warning signs and intervene before complications arise. Recent research highlights the value of specific autoantibodies and proteomic markers in predicting disease progression and flare risk. Comprehensive evaluation is particularly important when symptoms overlap, as comorbidities may complicate treatment decisions. Early recognition and ongoing monitoring not only improve patient outcomes, but also pave the way for more personalized approaches to care. Recent advancements in the field of autoimmune diseases have significantly improved our ability to detect and monitor conditions such as Sjogren's syndrome, fibromyalgia, and lupus. The identification of novel autoantibodies, including SP1, CA6, and PSP, has provided earlier and more precise markers for Sjogren's syndrome, allowing for timely diagnosis. Disease activity markers, such as those associated with increased lymph node swelling and kidney involvement, now help clinicians assess the risk of progression to more severe conditions like lupus. Additionally, proteomics-based predictive models have emerged, integrating both clinical and molecular data to forecast lupus flares and disease heterogeneity. These innovations offer new tools for personalized disease management, enabling healthcare providers to intervene earlier and tailor treatments to individual patient needs. As research continues, these advancements promise to enhance outcomes and quality of life for those affected by autoimmune diseases. Ongoing research is shedding new light on the complexities of Sjogren's syndrome, fibromyalgia, and lupus. Scientists are discovering novel autoantibodies and disease markers that help distinguish these conditions at earlier stages, allowing for more accurate diagnoses. Advanced proteomic models are now being used to predict lupus flares, offering clinicians valuable tools for personalized patient management. Studies leveraging electronic health records are also identifying key risk factors and sources of disease variability, deepening our understanding of how these autoimmune disorders develop and progress. As research continues, these breakthroughs are paving the way for more precise interventions and better long-term outcomes for patients facing these challenging diseases. Early recognition of Sjogren's syndrome, fibromyalgia, and lupus plays a vital role in effective disease management and improving patient outcomes. Identifying specific autoantibodies, monitoring disease activity, and utilizing predictive models allow clinicians to diagnose these conditions more accurately and intervene before complications arise. Timely intervention can help prevent disease progression, reduce symptom severity, and enhance quality of life for those affected. As research continues to uncover new markers and risk factors, healthcare professionals are better equipped to tailor treatment strategies to individual patients. Ultimately, increased awareness and early detection remain key to managing these complex autoimmune diseases successfully.